So I'm an orthopedic surgeon. I subspecialize in hip and knee replacement. I chose that subspecialty because it gives me the opportunity to make people more functional. Often patients come to me when their knees or hips hurt and they're wondering what the next step is. Often they're not sure what to do. They may have been an ex-athlete and maybe they've had some prior small surgeries on their knees or hips. Sometimes it's just someone who's been achy for years and they want to know, is there anything they can do to just be able to get through their day a little more easily. I'm Dr. Kraekal, and I'm an orthopedic surgeon. The nice thing is I can have a plethora of options that are non-operative and operative options if it's indicated for that patient to try and get them a little more mobile and functional. A big part of what I'm doing is trying to help patients tease out what the next step is for them. Sometimes patients need to just try out some anti-inflammatory, some basic pain medicine like Tylenol. They may just need to lose some weight and or utilize a walking aid like a cane. There are injection options that we can utilize, such as cortisone shots or hyaluronic acid shots, to try and help patients be that much more mobile. But often when those things aren't enough, surgery is the next option. And usually I advise patients to consider surgery when they've tried a number of these conservative options, and despite trying them, they're starting to see that they're not able to do the things that they want to do. If you're not able to perform regular activities of your normal life because you're so limited because you're hurt, we have a good option for that, and that's when patients should consider a joint replacement. So here at Houston Methodist, I think it's a great thing that we're always trying to lead medicine, and that's why we're utilizing technologies that will allow us to do that. And I think that the precision that some of these robotic options afford us is that they're going to allow us to be that much more precise with the surgery we're trying to do. We're trained to do specific techniques within the operating room to give patients the best outcome possible, and the idea is that robotics is going to allow us to do that much more precisely and accurately each time that we go in the operating room. When I look at my patients, I prioritize, what is the background of that patient. Every single patient I ask what their living situation is, not just what their normal background in terms of medicine is, but actually what support do you have at home to be able to go home after a surgery? Are you going to be able to go home? Do you have stairs that you have to do? Every single patient gets that question, and it's because I want to know how hard is it going to be for you to recover from this surgery, and what steps do we have to do to make specifically is it going to be easier for you? And so I think one of the things that patients get from us here at Houston Methodist is that we really are trying to give a holistic approach to making sure that this is a successful outcome for patients if they do need surgery. Likewise, if patients don't need surgery, we're still trying to cater all of the treatments to that specific need. I'm Kraekal. I'm an orthopedic surgeon at Houston Methodist. We're really excited to have a footprint in the Cypress community. So if you have hip and knee pain and you want a consultation, please come see me at Houston Methodist in Towne Lake.